Hi everyone, I am Dr. Lakshay Goel and today we are going to talk about the basics of robotics. And here with us today we have the Vinci Xi Robotic System, which is the fourth generation of robotic system. It comprises of three parts. This is the vision cart, this here is the patient cart, and this right here is the surgeon's console. So I am going to tell you a brief details about all of these. The vision cart consists of the touchscreen monitor, the insufflator, and the Irby cautery system. This is the endoscope controller to which we have the endoscope attached here. This is the robotic endoscope right here, and you can see the display on this touch screen. The special things about a few special things about this system is this touch screen allows us the surgeon's assistant to see as well as draw markings here which the surgeon can see in the console. So it helps in a teamwork. Also we have Firefly mode which is ICG compatible, and we have a Tile Pro system which allows us to overlay CT or MRI images while we are operating. The scope is 3D scope, so that's why we can see the left eye and right eye. So we can switch between left eye and right eye for the assistant, but for the surgeon it would be a 3D vision. This right here is the patient cart. The patient cart consists of 4 arms. The XI system has universal arms, so the camera can be docked on any of these of 4 arms. These arms have clutches which helps us move these arms. This here you can show a close-up here. This is the instrument clutch which helps to move this arm only the distal joints. So this will help move only the distal joints. But if you see here, this port will be moved. So you can port will not move. So when you use this clutch, you can use it while the patient is while the arm is docked on the patient. This clutch here is the port clutch. This port clutch helps move the proximal joints. So with the proximal joints, you can move the whole robotic arm. So along with port clutch and the instrument clutch helps us align the port while docking. So we can dock, and after that we have to use the instrument clutch while we advance our instruments. Also we have a patient clearance clutch here which helps move the arm after we dock. This helps us improve the clearance. So after we have docked, we have to have at least a fist arm distance between all the 4 arms. So if we do not have that distance, we can use this instrument clearance for that. Now this system has a mic as well as a speaker right here which helps communication between the assistant and the surgeon console. Now coming to the surgeon's console, this surgeon's console, if you can come closer, we'll show here. It has 2 eyes right here. So these 2 eyes helps give a 3D vision to the surgeon, and this is the touch screen panel which has all the controls, all the ergonomic settings, and these ergonomic settings come in handy while you are operating for long hours. So you can adjust this according to your height, you can adjust the wrist support according to you, you can adjust the foot panels according to you. So you have the cautery here for the left instrument, for the right instrument. You have the camera clutch which helps move the camera. So if you are pressing the camera clutch and moving the instruments, you will move the camera. And you can switch between your 3rd and 4th arm. So while you are docked, you have 4 arms, but 4 robotic arms, but you have only control for 2. So the camera is usually stable, and you can switch between any 2 arms, which helps you give the control of 3 working arms.